Hello. Good afternoon, everybody. Welcome to Asphalion webinar, DADi Q&A Beyond the Q&A document. Thank you for being here this afternoon. Before starting, just a couple of things to take into consideration about the webinar today. The webinar will last approximately 50 minutes. The speakers will go through the questions that you have previously submitted. And in case that you have further questions as the webinar goes by, you can submit your questions in the chat, or also you can send them to the address that I will copy in the chat. We will compile all new questions and answer them in a document that we will send you together with the presentation in the next couple of days. And now it is my pleasure to introduce the first speaker, Lourdes Martín, Regulatory Information Specialist at Asphalion from Data Management Unit. Lourdes is biologist by training, and after an extensive period where she devoted to research and development on genetics and neuroscience, she then started her career in the pharma industry in the regulatory affairs and regulatory information areas. Also speaking today will be Vicente Tur, Regulatory Affairs Director at Asphalion at the e-submissions unit. Vicente has a degree in biochemistry and a PhD in structural and computational biology. The objective of the webinar today is decoding DADi through the Q&As that the speakers have previously received from many of you and helping you navigate the DADi questions and answers document. So now Vicente will take it from here. Vicente, please, whenever you are ready.
Yeah, thank you. Thank you, Lydia, for this wonderful introduction. So first, for starters, let me introduce our company. So we are Asphalion. We are an international scientific and regulatory affairs company. We give consultancy services for already more than 20 years. Our headquarters are based in Barcelona, but nowadays we have offices in Madrid, Munich, and London. So we've been growing quite a lot on the last years. We have more than 150 team members in different teams. We have handled projects for almost 1,000 different customers, more than 4,000 projects, and we have customers from over more than 50 countries. So if we go to the next slide, please. So as a company, we give a wide variety of services, usually, I mean, from regulatory and scientific strategy consulting, medical writing, scientific writing, CMC, not only for chemical products, but also for biological products, biosimilars, advanced therapies, and so on. Also, we give some global submission services, especially my team, ECTD publishing services, but not only. I mean, it's a full outsourcing service from CMC writing, Model 1 writing, ECTD compilation and submission. Also, we have a dedicated team for specifically data management because this is a topic that has been growing on the recent years. And also a very dedicated team of pharmacovigilance. If we go to the next slide, we can focus on the services that are given in my team. Basically, but not only, we give comprehensive ECTD publishing services, not only for Europe, but in all worldwide regions where ECTD is accepted. So basically many regions, USA, Canada, Switzerland, the Gulf Central Cooperation Committee, and some others. We also have a dedicated team for software installation, ECTD software related trainings, software tools validations, and dedicated support for this. We are quite experienced on submissions all over the world, from Europe to FDA and some other countries. And I mean, we also have a specialized team, not only about technical knowledge, but also for dedicated project management and critical timelines, because we know how critical these kind of services are in the regulatory world. So now I'm giving the voice to my colleague Lourdes. She will be giving most of the introduction and the main part of the webinar. So thank you very much.
Thank you. Welcome everyone. So I continue here to tell you a bit of about the data management unit. So we work efficiently and proactively supporting submissions to XCMPD for new MAs, updates, invalidations, suspensions, and others. We have been doing this since the start of the application in July 2012. We manage an average of 3,500 EXUMPD petitions for over 30 clients a year. We also offer a comprehensive and strategic consultancy on the transition to ISO IDMP, all focused on data analysis, mapping, enrichment, and maintenance, and a wide-ranging support for the implementation of RIM system as well, from design and review to the execution steps for migration, validation, and all including trainings. We have supported the implementation of RIM system in over 10 companies, from a wide range of portfolio and products, and we have a dedicated team for ISO ADMP and data governance. So to start in the topic for today's webinar, we know that Emma has published this Q&A document on February this year to try to clear and clarify some of the doubts that have been coming up with the introduction of DADi and all that is happening with Spore and ISO ADMP. So let's start from the beginning with what is DADi. So DADi comes from Digital Application Dataset Integration. DADi is the new electronic application form, and this one will replace the current PDF-based e-application form. So how is this DADi web form? First of all, it's interactive. It will be used for human and veterinary. It uses structured data and allows automated data imports into the form. It will cover initial marketing authorizations, variations, and renewals. And as an output, it will provide a human-readable PDF along with a XML that has FHIR formats, which is new to comply with the new standards that are set. If we look into what is now with electronic application form and how this interactive web form will be, we can see that now we have a PDF form that is interactive and generates then a PDF file from which you can then get your XML message. And this is included in the ECTD sequence or NIST package. DADi will be this interactive web form that, when completed, will generate the PDF rendition as the human-readable portion, along with the machine-readable XML rendition in the FHIR format. And this as well is included in the ECTD package or NIST package. But when is this change coming? So what is the implementation timeline for DADi? So first of all, it starts only for human variation, and the implementation will be in October 2022, so this year. The timelines for the release of the remaining forms are still to be confirmed, so we don't have yet a calendar that is clear for veterinary variations, neither for initial marketing authorizations or renewals. There will be a transition period with a go live for human variations. This transition period means that the parallel use of the current electronic application form, which is the PDF based, can still be used along with the new web form, that is the DADi web form. And it is expected that around April 2023, then it becomes mandatory to use the DADi web form, and we should stop the use of the old form for variations. So now we know what to expect in regards to the timelines and what will be covered at the go live. So one question is, what is the data source for DADi web form? Because we saw at the beginning that this is allowing structured data. So the source is Spore. And Spore is a program that is implementing the EMA. Spore comes from substance, product, organizations, and referentials. If we look a bit closer, these substance, product, organization, and referential are 4 management services that work together as a validated database. And what this allows is having structured data that allows the view, the search, the export, update, and reuse of this structured data. We know that OMS and RMS have been launched already, and currently the electronic application form that we use now is actually taking information from OMS. The SMS service is being constructed at the moment, and the PMS, which we'll be discussing a little bit more later on, is now related to DADi, as currently information from XVMPD will be migrated to PMS, which will be the base of the structured data that DADi will be taking on. So Spore is an ISO IDMP compliance business service for the central management of data. This means that Spore is the way of the EMA to implement these ISO IDMP standards. But what is this ISO IDMP? So these are 5 norms that were developed by ISO. And the idea is to internationally harmonize the specifications that allow the identification of medicinal products. There are 5, 1 for substances, 1 for units of measurement, for pharmaceutical product, medicinal product, and controlled vocabularies. And altogether, this provides the data elements and the structures that allow this unique identification and the exchange of information on structured and standardized data. So we have now gone through some of the questions that help us understand what the implementation of DADi means and what DADi means, in an effort to clarify many uncertainties that still remain. Then the EMA published the Q&A document, and we have split all the questions in 4 main topics. So general information about DADi, some of which we have already discussed in the introduction. The impact on the veterinary medicines, interaction with different stakeholders, and the impact on human medicines. So the first block on general information covers deliverables, next step, format, interface, and the use of the form. So to start with, one of the main questions is what is actually changing with DADi. And this is actually a graph from the EMA, which is very good. So we wanted to show again here that DADi will change the PDF format electronic application form into these new web forms. And this happens for variations, initial marketing authorizations, renewals for humans only, and that still other submissions are under consideration. But these DADi web forms apply to both human and veterinary, and they apply to centrally authorized products and to nationally authorized products as well. DADi will not change the current PDF output format. The process itself on how you submit or apply for marketing authorizations, and the content of the application forms that you include in your submission package. One of the questions that we often see is if MRPs or national products are also supported by DADi, and the answer is that indeed these are included within the NAPs for DADi, so they are covered. If we take a look a bit more closer into what the current e-application form has versus the DADi web form, we can see that today we have this PDF-based e-application form that can be filled by anyone, but with DADi, you have to be an EMA registered user. As well, with the PDF base form, only one user at a time is allowed. However, if you're working with the DADi web form, then you can have multiple users filling out the form. There has been a lot of questions regarding the signature, and yes, both will be signed. And regarding to the source data, as I say, the PDF base that is the currently application form is already taking information from the Organization Management Service, OMS, and also have some manual input. In the future, it is expected that most of the information coming to DADi comes from PMS and OMS, with minimal manual input into the form. And regarding the output, today we get a PDF rendition that we include in the ECTD sequence from which we can produce our XML message. However, with the DADi web form, the output will be a PDF rendition that already includes the XML message with this new FIRE format. And this as well is to be included in the ECTD sequence. So now here, Vicente, we have received some questions that we can discuss at this point. So one of them was if you can still use the DADi form and then revert to the old PDF base form later on, or if it's the case that once you use the DADi, all future variations must also use the DADi form.
Okay, thank you for Lourdes and thank you everyone for the questions. I mean, before answering this first question, just at the general and obvious disclaimer, right? I mean, we are answering the questions now in March 2022, so we still have some months, no, until this goes live. So there could be additional changes, but I mean, we will be answering, no, with the current information we have currently available. And going back, no, to the answer of the first question, in principle, it's important to understand, no, that there will be two different periods. First of all, we will have the transitional period. Afterwards, we will have the mandatory use of the DADi web interface that is expected in around 1 year from now. But meanwhile, we are during the transitional period, the approach would be similar to the current use of the electronic application form. So when you start a procedure, it doesn't matter if you use the PDF form or the DADi web interface, but you will need to continue this same regulatory procedure with the same approach. But on further different regulatory activities, you can choose a different one. So let me summarize this. No, if you are under the same regulatory procedure, the starter option you use to start this regulatory activity, you will need to continue with this one. But you can go back to the PDF web form, for example, on your next variation. I think this would be the answer with the current information.
All right, thank you. I'll have another question. So what should the marketing authorization holder do at the DADi Go Live when their list of manufacturers is not correct?
Okay, so there could be, and probably you will find no errors in manufacturer's information when DADi goes live, and at the end, this information you cannot modify it via XCVMPD. And obviously, CIAMET is a tool for authorities, but still, at least with the current information, you will be able to modify, correct, complete the product data in the present section in the DADi web form. It is expected that also in the future, no, PMS will cover the modifications on this, but in principle, and with the current information, we will be able to modify incorrect entries on DADi.
All right. Another question is related to the signatures. So what will be the requirements for application forms signed with the qualifying e-signatures? And if we have to include the PDF rendition from DADi and an electronically signed document separately in the ECTD sequence as it is done with the current e-application form?
Well, there has been a lot of conversation regarding the digital signature, because this is something that it has been recently discussed in Europe. I mean, for example, we have the case in the States, the use of digital signature in the application forms in the 3568 form, or even in the 1571. You can use the digital signature for many years already. So in our current case, for the moment, the specifications, I think Europe will rely on the ICH working group on digital signatures. So whenever this working group release information, this will be given to us from a European specifications perspective. And also, in principle, this DADi form would be possible to be signed with a PDF rendition and with digital signature. Still to see the details, but also remember that as many authorities already extract information automatically from the electronic application form, any PDF signature, any PDF version that is modified probably will need to be added inside the ECTD sequence as an additional document, as a duplication of the already functional web form, DADi form, or electronic application form.
All right. And the last question for now, we still people wonder is who owns and maintains DADi?
Okay, so DADi, I mean, the webinars are given by the EMA, so the system facilitating the technical support is EMA. You may contact, and you will be able to contact the EMA service desk. But it's important to understand that also Unicom is contributing to DADi, and Unicom is a European Commission Horizon 2020 consortium that is funded.
Right. Thank you, Vicente. So I'll continue now. Another question was what the benefit brings. What are the benefits that the DADi web form brings? And it's basically that is user friendly, that allows efficient processing of information, and that it allows the integration with PMS and UPD, which are the databases for medicinal products and human and veterinary. So in general, it facilitates the interoperability of the different systems, facilitates data sharing, supports efficient validation from NCAs, therefore reduces time and efforts and minimizes errors, and allows progressive improvements. So moving to the block of the impact on veterinary. The veterinary forms for DADi are in scope, and they will comply with the veterinary medicines regulation. The timelines are still to be defined, and they are just not clear. And the new veterinary form will feed as well from standardized data coming from UPD, which is the equivalent of the PMS for human. And they will as well be using the FHIR format. The current PDF format for the electronic variation application form has been already updated to support the new regulatory requirements for the January deadline. So Vicente, there was a question related to this, and is that why was the approach taken to not implementing the form for veterinary along with the humans?
Yeah, I believe this was a specific question, that was done on one of the webinars, and it was because at the end there were too many things at the same time. No, at the end we are having a change on the veterinary regulation, and also adding an additional, let's say, new technology at the same time that the regulation is changing could be too much. So at the end, the approach would be to wait a little bit to reduce the risk, no, of having a new technology, also disrupting or making more complicated adaptation to the new regulation in veterinary medicines.
All right, thank you. So moving to the third block, which is related to medicinal products. This focus more on how DADi links to Spore and to ISO IDMP. So what happens when DADi goes live is a very good question, right? So we know it comes in October 2022. We have seen that it will use structured data from PMS. And we know that XEMPD data will be migrated into PMS before the DADi go live. Emma will do a one-to-one direct migration of data for those fields that are equivalent between XEMPD and PMS, but also it will do some rule-based migration for data fields that are not equivalent and where they have to use some transformation of the data to fill the correspondent fields in PMS, but also to allow the compliance with ISO IDMP. One thing that is clear is that at the DADi go live, there is no possibility to do submissions or enrichments or corrections to the data in PMS, as well as there is no feedback loop, meaning that whatever is in DADi web form won't be feeding into PMS. One important thing to have in mind is that as PMS won't be open to receive any submission, then we still have to submit the XEMPD messages or submissions to XEMPD database to comply with Article 57. So these submissions are still needed, and this is important to remember. Another thing is that we have to ensure that the data that is in XVMPD is complete and correct, because this will be migrated to PMS, and this is what we will see when we will be using DADi. We have to be aware of that data when we're using the web form, and as Vicente commented before, we can still correct it during the transition time in the form. But we still have to wait for EMA's news on the implementation of PMS and other clarifications regarding DADi and the interaction with the databases.
Okay, thank you very much, Lourdes. I think we still have time for a couple of questions before going to the last part of the webinar. Because meanwhile, you were explaining this last slide. We have some questions also related to PMS. I think this is the big question mark on all this implementation. So the first, let's say, question would be when DADi goes live in October. Would DADi go live with a PMS data load already, or would be basically an electronic application form replacement?
Right, so the DADi will be getting information from PMS, so it will automatically take information from the products from PMS. However, EMA still have to show the development and have to go through the migration of data to understand better the scope. They have recently given a demo for DADi showing the progress that they have made over the past 3 months. And they are planning the next phase, which will be coming in the next few weeks. And they will reconfirm what the scope is for the first release of DADi. And they do recommend to keep an eye on the submission website for more news. But what we can say for sure is that DADi will be feeding from data from PMS. However, this data won't be clean data, will be the data that is migrated from XVMPD and from another database from the EMA, which is CIAMET. So there will be a combination of data here that will be seen in DADi.
Okay. And another question related to PMS would be when is expected to happen the first migration to PMS?
Right. So the
If
EMA is currently working on the migration, and they are trying as well to have a continuous synchronization of data with both the CME database and the XVMPD. They say last time that they will consider the work completed as soon as the first successful user acceptance tests happen, and they're actually now starting to set up the working groups for this user acceptance test. So there's still information that we have to be waiting for in the next few months about this.
okay, great. All this information, I think we still have many different questions. We will be gathering additional questions from the audience and provide them compiled, because I mean there are still many questions. In fact, we have some additional questions about PMS, if it's this data going to be clean when migrated, when it's going to be uploaded to BMS, all that information, what is going to happen with missing data, but probably this will be answered during the next months or even years probably.
Right. So as I say, the data from PMS won't necessarily really be clear or correct. It will just be the data that is currently in CMED and XVMPD. There are fields that have a combination of both, or fields that are empty or will remain empty because data was not available in any of those databases. So this is why it's important to really check what data is in those systems as well. The thing to remember as well is that we have to wait for when the implementation will happen to start putting the effort to really understand what the impacts of this is. But there is a lot that we can start to do now in regards of data, and all in preparation to be compliant with ISO IDMB.
Okay. Okay, that's great. I think we are running out of time for questions.
I'll continue with this part, which is related to what we discussed now, and this is the interaction with the different stakeholders section of the Q&A. So what is the impact for industry, stakeholders, and competent authorities? So if we see on how will the regulatory process be when DADi goes live, this is what we can assume will happen. So we'll have the DADi web form that will be feeding from data from PMS. This data in PMS, as I say, is the data that was mostly migrated from XVMPD, but as well we know now that it contains as well data from the CMED database. So when the industry starts preparing the submission package, it does the ACTD compilation, and it includes this DADi web form. It goes through the submission process, and then the competent authorities will go through the receive, the validation, the assessment, and the decision making. We have to remember that for the industry, it's still mandatory to do the submission after approval for the XCMPD database, that we still have to comply with the Article 57. And this loop here, or this feeding information, will continue to be there. So even though the migration will have happened for the DADi go live, EMA is working on maintaining the information from XVMPD to be feeding into PMS almost instantly, or so they say last time. So they have to still test this and work on this, but that's the idea. So there are implications for the team that is creating, maintaining the DADi form. There is implications for EMA, implications for the industry and the regulatory agencies, and still a lot of uncertainty on what will be expected at the DADi go live. So we have to wait for this period where they are doing the migration and testing the forms to see the news about that. What is clear for now is that we can focus on the data that will be migrated to PMS, on the data requirements of PMS, and we have the guidelines to focus on that have all the requirements, so we can start to understand how the industry can prepare in the meantime. So in this regard, what can Asphalion do for you? So as we said at the beginning, we have a wide range of services. We offer consultancy and project management along the different services. So trainings, for example, related to DADi and ISO IDMP. So we have awareness for ISO IDMP, specific training for the data requirements for PMS, introduction to Spore services, and then services that are related to data governance, data analysis for ISO DMP, the data quality check for XBMPD and Spore, data maintenance, and of course for technology, which is a very important part of all these changes happening now with ISO DMP, Spore, DADi, and others, which is the RIM implementation. And what we mentioned as well, the portfolio maintenance, which covers regulatory support for submissions, like the maintenance and submission of XCMPD, but also regulatory procedures, and CMC writing for different type of submissions, as well as the ECTD publishing support with the dossier compilation and the full life cycle outsourcing. Vicente, I'm not sure if you want to make another comment.
No. Thanks a lot, Lourdes, for this wonderful presentation. I mean, we are really proud and happy to have you with us. And well, as said, I think Lydia put at the beginning in the chat an email address, so you can still send us some questions. As Lydia said, we will try to send you the presentation and gather all answered and still unanswered questions in the upcoming days. And we will try to answer all questions received. I mean, for sure, things that EMA doesn't know yet, we will not be able to answer either. But I would say that thanks a lot, everyone, for attending this webinar and looking forward for the go live of DADi.
Right. Thank you very much, everyone, for being here. And thank you to all of you who submitted the questions. We hope we answered them and that things are a bit more clear now.
Yeah.
But yeah, if you wish and you still have doubts, you can always write to us. And perhaps then this means that another webinar can come with more specific information once the process with the migration from PMS to DADi happens and the UAT starts and all of this. So yeah, thank
For
you
sure,
very much.
we can commit to give a second webinar when things get closer. Thank you very much, Lourdes.
Thank you. Thank you, Linda.